Hello, and thank you for viewing our presentation on the benefits and barriers to achieving a healthy pregnancy. Our group is comprised of Kimberly, Dania, Stephanie, Valerie, Ijoma, and Sade. For this presentation, we will be talking about ways to lead a healthy pregnancy and things that can put you and your baby at risk. To end, we will be talking about a few key takeaways and some resources for expecting mothers. We'd like to start off with talking about ways that you can benefit your pregnancy through nutrition and exercise.
Preconception nutrition is extremely vital for preparing for pregnancy. All women of childbearing age need to take in the recommended daily amounts of folic acid, iron, and calcium. In order to support their baby during pregnancy, expecting mothers need to maintain a healthy diet and weight gain, promote fluid intake, take the recommended daily amounts of prenatal vitamins and mineral supplements, as well as knowing which foods and drinks to avoid and or to limit. The My Pregnancy plate shown here is very similar to the general My Plate guideline. When choosing foods to eat, it's important to remember that the mother is not only eating for herself, but also for her baby. It's always great to have a variety of fruits, vegetables, protein, and whole grains on your plate, and also keep in mind the more colors on the plate, the better.
The importance of maintaining a healthy weight and exercising. Physical activity rejuvenates the mind, body, and spirit. It reduces stress, it increases happy hormones, and it reduces the labor and delivery time. A great resource is Kiara Lachey's pregnancy workouts, YouTube videos, DVDs, and online gym with workouts for everyone. Can be found at teamlachey.com or ifyoucanmove.com. Some safe exercises for pregnancy include yoga, walking, swimming, and dancing. Here are some unsafe exercises: hot yoga, basketball, horseback riding, and boxing. Recommendations for healthy pregnancy weight based on pre-pregnancy BMI and weight. For example, if your BMI is in the normal range, it is recommended that you gain 25 to 35 pounds.
Now that we've talked about how to lead a healthy pregnancy, we would like to talk about some of the barriers that women may face during pregnancy. The three that we will highlight today are teratogens, pre existing conditions, and risk factors that disproportionately affect Black women.
One barrier to achieving a healthy pregnancy is teratogens. Teratogens are any type of agent that can cause harm to a fetus. This includes, but not limited to, prescription drugs, illegal drugs, alcohol, smoking, tobacco, pollution, radiation, mercury, lead, and lithium. The effects of each teratogen varies and is dependent on other factors, such as dosage, heredity, age, and outside influences, such as unhealthy home environment, stress, and pre-existing conditions. An example of the effects of teratogens is fetal alcohol syndrome, which is caused by maternal drinking. Children with FAS may display facial abnormalities, learning and behavioral problems, growth and developmental delays, or low birth weight. Prescription drugs can also cause harm to a fetus, including birth defects, premature labor, low birth weight, and neonatal abstinence syndrome, where the fetus is born addicted to those medications and goes through withdrawal.
We would also like to highlight pre existing conditions such as autoimmune diseases and infections. These are both barriers that women may face during pregnancy due to a weakened maternal immune system, which can lead to many complications during pregnancy. One autoimmune disease is human immunodeficiency virus, or HIV, which can be passed on to the fetus through the placenta, but most commonly during birth. To decrease the risk of transferring HIV to a child during birth, it is recommended to take anti HIV drugs throughout pregnancy and labor and deliver by C section. By following these guidelines, 99% of HIV infected women will not pass HIV on to their babies. STDs and STIs also pose a threat to babies. It is common for the mother to be screened for STDs at least once during pregnancy. On the right side of the slide, we've listed common STDs and STIs and the effects that it can have on the baby. Other effects not listed include eye infection, pneumonia, brain damage, deafness, or chronic liver disease. Antiviral medication can be used to reduce the risk of transferring STIs such as chlamydia or syphilis, but viral infections such as hepatitis B and C cannot be cured.
We wanted to take time and specify risks and myths that regard Black women. The most common pregnancy complications that disproportionately affect Black moms are gestational diabetes, a form of diabetes that occurs during pregnancy, preeclampsia, sudden onset high blood pressure alongside other complications, and heart disease, the leading cause of maternal death in the US. To reduce these disparities, multiple sectors need to work to address the factors that contribute to these deaths, one of them being medical racism. Medical racism is prejudice and discrimination in the medical system. A 2016 study conducted by PNAS found that 73% of white medical students believed that black people had a higher pain tolerance than white people. This harmful myth leads to over or underdiagnosis of certain conditions, harming both mother and child.
But we'd also like to acknowledge that there is a bright side. Studies have found patient-physician racial concordance has benefits on improving healthcare disparities found due to inequities in clinical care outcomes. Another study also found that diversifying the medical workforce may be key to improving health disparities across racial and ethnic groups because people from these groups tend to serve in communities that they come from. We'd also like to highlight that women account for a majority of the OBGYNs and approximately 11% are African American women. We also want to reiterate that a healthy pregnancy journey is multifaceted, and therefore it's important to remember to get plugged into obstetrics and gynecology care to discuss past medical history, maintaining a healthy diet and activity, and any risks that may be associated with your pregnancy journey. And to conclude our presentation, we've listed a few resources available for expecting and current mothers, including WIC, Medicaid, and TANF. And you can also contact your local health department for other supportive options. Thank you.